I'm Larry Farver, and let's queer up the world view. Iran war triggers condom shortage and raises HIV concerns in India. India is facing a growing condom shortage after months of the U.S. Iran war, raising concerns about health advocates about the potential impact on HIV prevention efforts, especially within the country's LGBTQ community. Disruptions in maritime trade through the Strait of Hormuz have strained supplies of petrochemicals and industrial lubricants used in condom manufacturing. Industry experts say that shortages of silicone oil and rising ammonia costs have sharply increased production expenses. Some manufacturers and retailers report condom prices have risen more than 30%. India's condom industry is valued at nearly $1 billion and operates on a high-volume, low-margin model designed to keep products affordable for the country's population of more than 1.4 billion people. According to India's health ministry, the country is home to an estimated 2.5 million people living with HIV, the second largest HIV-positive population in the world. The ministry reported that 5.4% of HIV cases between 2024 and 2025 involve transmission between men who have sex with men. LGBTQ activist Ankit Bhuptani warned the shortage could reverse years of progress in HIV prevention. Harish Iyer, another LGBTQ activist, urged government to classify condoms as an essential commodity and expand free distribution through programs like the Nirodh Scheme. Well, you know, the impacts of war and global impacts, and we're seeing, you know, price rising, cost of living, and things rising here as a result of our involvement. I did some research, and it was interesting to see that the Nirodh Scheme has been around supporting condom distribution since 1968. So there's a large history there, and we can hope that the right resources present themselves with India's government and society to prevent the spread of STIs, including AIDS.
I mean, can we note that out of the 2.5 million people that are infected with HIV, that the new cases, only 5.4% were the gays? So, guys, it's not the gays. And yet the gays are being the loudest voice of saying, hey, we need to keep this going.
Absolutely.
So, yet again,
I feel like the gays are more, the voices of gays are louder because we are so much more accustomed to talking about safe sex practices and condoms.
But the reason why I'm bringing it up is we have so much backlash against us that we're the ones causing these problems, that we're the ones, you know, not doing anything about it. And this is proof that we're the smallest number of infected cases, and we are the ones still advocating the loudest for the prevention.
Well, we should be careful not to overly put like the U.S. LGBTQ HIV experience right onto India. That being said, yeah, of course, we all hope that they're able to get condom production back up in India. But like at the end of the day, many of the petrochemicals that India needs to produce latex and to do all sorts of other things from fertilizer is being blocked because one psycho, one boneheaded idiot decided to start a war with Iran. For the audience who is too young to remember 9/11, going to a war with Iran is such a stupid idea that George W. Bush never proposed it. Think about that. George W. Bush never wanted to go to war with Iran. That's how bad of an idea it was that man knew you shouldn't do it. And the Iranians have done such a brilliant job of taking control of the situation. They are now ending the international law where you can't block a strait. Too late. Now they can do it. I don't think they're going to end blocking the strait without paying a toll. India and Vietnam and other Asian countries are having to make all these special deals with Iran, and the U.S. says they're going to put sanctions on them for doing it. And I'm like, well, they need the oil more than they care about the U.S. sanctions. This is an absolute international crisis, and Americans don't realize that. They do not realize that, not just with this Indian condom story, but the way that they're not going to work. They're not driving in parts of Asia right now.
It's not just that. I mean, I work in manufacturing, and the oil, it's all industries. It's affecting Spain in all industries. It's affecting Vietnam. It's affecting all industries because this is where they get their fuel from to produce these items. So it's a huge trickle-down effect.
I mean, at the very least, if we're talking about European supply, we can say that you can route through the Red Sea or the Suez Canal, which can give you access to the Mediterranean. The problem is that in Asia, where a lot of these products are manufactured, Strait of Hormuz is pretty much the only way in, alongside the Malacca Strait. And these are choke points in global logistics, global commerce. As the resident, international relations guy, as introduction, this war is costing trillions of dollars for no valid reason. The claim that, Iran has nuclear weapons. So does Israel. Unfortunately, it's a commonly, it's unofficial, but commonly acknowledged fact.
Did the nation that started this war also have nuclear weapons?
Yes.
Okay, so I really just want to have to emphasize people, this war is so crazy and harms so many people that, I don't know how countries like India and China are able to maintain a good relationship with the United States. It's against their interests at this point, and that's kind of crazy when you think about it.
Right, and unfortunately, like the story says, that they want them to declare condoms as an essential commodity. If you do that, then where does that money come from? Where are you taking that money from? What other things are you taking the money from?
Even if you do that, if enough petrochemicals aren't coming out of the Middle East, what's it you're going to do?
Correct.
That's to me at the heart of this story, and that is a tragic story that I hope this is solved. And there's no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight.